My name is Matrice Littles, and today I will be doing wound care. I will be applying and removing dry, wet to damp dressings. Before entering the patient's room, I first want to check the doctor's orders. I also want to check for any precautions and gather my materials. For purposes of the video, the materials are already inside of the patient's room. I'm going to wash my hands. Make sure to knock on the patient's door and announce myself before entering. Nursing. I'm then going to introduce myself to the patient. Hi, my name is Matrice. I'm your nurse for today, and you are?
Dina.
Dina. Very nice to meet you, Dina. I am going to verify Dina's identity. So I'm going to check Dina's wristband. I'm also going to check for a second identifier. I'm going to check for any allergies that Dina may have. And because of today's procedure, I want to make sure to check for any tape allergies. That's very important. Once I've done that, before starting the procedure, I want to assess for pain. So, Dina, are you experiencing any pain?
No.
Okay, because Dina is not experiencing any pain, we can proceed with the procedure. If Dina was in pain, I would need to administer pain medication and return in 30 minutes and check her level of pain before going forward with the procedure. So since Dina's not in any pain, I want to raise the bed to a comfortable working position so I can maintain good body mechanics. I also want to explain the procedure to Dina while I'm doing that. So Dina, what we're going to be doing today is a dressing change. We're going to take off the older dry dressings and apply some new damp dressings.
Great.
Okay, so do you understand what we're going to be doing?
Yes.
Okay, so now that I know that the patient has a clear understanding of the procedure, I'm going to help Dina get better positioned so I can perform the procedure better and also so she can maintain a certain level of comfort. So, Dina, can you assist me at all with rolling you over?
Sure can.
Okay. What I need for you to do is take your left leg and put it over your right, and then take your left arm and grab the side rib. You're going to roll, all right? And so can you scoot back just a little bit? Push and scoot. And then let me get you to lay flat for me. Thank you. Once I have Dina positioned comfortably, I'm going to, again, wash my hands. And I'm going to put on clean gloves. I do not have clean gloves, but we'll just have to pretend that I'm putting on my clean gloves. Once I have my clean gloves on, I'm going to remove the old dressings and dispose of them in the biohazard receptacle. So I've done that. I want to take those gloves off and dispose of them as well. I'm going to wash my hands again and put on another pair of clean gloves. Once I have on the second pair of clean gloves, I want to take saline moistened gauze and clean the area. So I'm going to clean the wound. And I'm also going to clean the area around the wound. Once I've cleaned the wound and the wound area, I want to assess the wound and the peri-wound. So when I'm assessing the wound, I want to assess the color, the size, the location of the wound. I also want to check for any signs or symptoms of infection, and I want to check for drainage. After I've assessed the wound, I want to check the peri-wound area. In doing that, I want to check texture, temperature, skin integrity, check for any pustules, any papules, any lesions, any maceration, any stripping. And I also want to check the color of that area. Oh, and when I check the wound, I also need to check for odor. and the wound is fine. So we're going to go ahead and start impacting the wound. So I'm going to take off those gloves and dispose of them, wash my hands again, and put on my third pair of clean gloves. So once I don clean gloves, I want to take fine mesh saline moistened gauze and put these inside of the wound. And I want to make sure to get in all depressions of the wound. And if necessary, I would take a second saline moistened gauze and stuff the wound. And so once I've gotten all impressions of the wound, I'm going to take a surgical pad, which is dry, unlike the gauze, which were moistened. So I'm going to take a dry surgical pad and put that over the top of those gauze. And I'm going to tape that surgical pad down, and I'm going to tape it like a picture frame. And again, earlier I would have checked for any tape allergies because that's very important. Because the patient has on jeans, which wouldn't ordinarily be the case, the surgical pad is not staying in place, but under ordinary circumstances, the surgical pad would stay in place. Now that I have the surgical pad in place, I'm going to assist the patient back to a comfortable position and lower the bed all the way to the floor. Miss Tina, can you help me roll over again? Now that she's in a comfortable position and I've lowered the bed all the way to the floor, I need to do some patient teaching. So I'm just going to teach Dina about the healing process. I'm also going to teach her, any caretaker that she may have, about any signs or symptoms of infection and the importance of reporting signs and symptoms of infection as soon as possible. During the procedure and also after the procedure, I would do an evaluation. I would just be evaluating for any pain during the procedure and just like how well she tolerated the procedure. I also need to assess the wound daily and make sure that it remains, make sure that if it leaks or becomes dislodged or wrinkles, that it gets changed. I would need to assess I'll go on to documentation. So when I document, I want to make sure to document if any pain medication was administered. And if it was administered, I need to tell the drug, the dose, and the time it was administered, and also the patient's response to the medication. I also want to document the wound and the peri-wound area. So I'm going to tell the size, the appearance, the location, and when I document size, I want to tell the diameter, the width, and the length of the wound. And I would just document any findings with the peri-wound area. I want to also, during my evaluation, I needed to make sure that the patient verbalized an understanding of the procedure. And in documenting, I would document any patient teaching that I did. I would also need to document the type of dressing that I used and just the way that I cleansed the wound. And I believe that that's all.